Now we have come to the final part of the community pharmacy. And in final part, we'll be understanding the roles and responsibilities of the community pharmacy. Now let us start the session. The different roles played by retail or community pharmacy. One by one, we will see the different roles. The following are the area where community pharmacists can be actively involved to serve the community. In all drug-related problems, DRPs, like counseling on proper use of OTC and prescribed medications, recording of drug and medical problem histories, immunization schedules, the refer of patients to the specific healthcare professionals. These are all some of the important role played by community pharmacy in the society. A community pharmacist may also involve actively into the area of pharmacoepidemiology for determining the safety and efficacy parameters of the drug therapy to avoid unwanted effects. Pharmacoepidemiology is the post-marketing phase of clinical trials of a drug which concern with the safety or risk assessment of a new drug after releasing into the market. A community pharmacy may involve in the control of serious communicable diseases by providing or by making community awareness through counseling. By this method, a lot of disease like tuberculosis, syphilis, all the sexually transmitted infections, gonorrhea, herpes genitalis, AIDS, and hepatitis can be controlled. A community pharmacist can encourage the patient to prevent themselves from various chronic diseases by using various proven techniques of prevention, like risk of strokes of heart can be reduced by proper counseling and by control of high blood pressure checkups, by screening the patients, regularly intake of prescribed medications without deviating from the prescriptions, by stressing about medication adherence, quitting all the unwanted problems like drug abuse, smoking, controlling high blood pressures by proper screening, and advising the patients about the importance of drug therapy, lowering cholesterol intake, and increase in physical activity. The community pharmacist may also involve in patient healthcare education through use of pamphlets, and which will be written in local languages and which can be given to the patients in the form of patient information leaflets. And community pharmacy may be actively involved in providing counseling to the pregnant and lactating mothers, and he can advise a special diet about the maternal and child health. And he can tell the patients about hygiene, principles of hygiene, management of pregnancy through maternal diet and other diseases and subnutrition status. And he can avoid the various disorders regarding about protein energy malnutrition and other disorders in case of pregnancy or in case of lactating mothers. A community pharmacist can also play a major role by guiding the parents for the protection of child against the disease of childhood by proper immunization schedule. He can list out the immunization schedule and he can give it to the mother, and he can remember the parents regarding about immunization schedule, and he can tell the importance of immunization schedule, whether it may be polio or any kind of immunization. A community pharmacist may guide the patients regarding about nutrition intake according to the requirement of the patient and their disease state. A community pharmacist can make community aware about environmental health like foodborne disease, local hazards, the carcinogens, etc. So lastly, we will see this slide and we will end and will conclude the community pharmacy topic. So we have seen the establishment of professional pharmacy, how the establishment of professional pharmacy has to be done, and we have seen dispensing of medication. The qualitative medications has to be dispensed, which we have to receive from qualitative vendor, wholesaler or stockist. Then only we can see the quality. There should not be any compromise in the qualitative medications. Community pharmacist can serve as a family pharmacist, where he can maintain the patient medication record and he can serve one and all the pharmacy. I mean the patients who are in the patients. He can serve as a family physician in just the same manner he can serve the family pharmacist by maintaining all the patient medication records. Community pharmacy plays a very important role in patient counseling regarding about disease and drugs. Community pharmacy is a point of contact. The pharmacist, especially the retail pharmacy, is a point of contact in treating all the common and minor ailments. Community pharmacy can provide a very valuable clinical services to the patients. Community pharmacist can provide variety of health screening programs, and he can conduct mass campaigns about hypertension and diabetes mellitus, arthritis, and all diseases like hypercholesterolemia. Many diseases he can conduct the screening programs. Community pharmacy can provide home care services in case of elderly and bedridden patients. Community pharmacy can provide the professional relationship. He can build a professional relationship with the patients, and he can advise regarding about all the community related disorders. Community pharmacy can provide a valuable drug information services regarding about the drug and its side effects. Community pharmacy should engage in continuing education to keep himself updated regarding about various aspects of drugs and the treatment strategies. That completes and concludes about the community pharmacy. And last role of community pharmacy is that health promotion. The earlier state was only the curability. From curability, it went to the prevention, the preventative modality approach. Now promoting health by various ways, by giving the patient information leaflets and providing the mass campaign programs, and he is one of the important pillar of the healthcare society. This concludes the role and responsibility of the community pharmacy, and here we are concluding by summarizing the whole chapter. We have seen the community pharmacy is a legally established premises where registered pharmacist is involved in compounding and dispensing of medicinal products, various services rendered by pharmacist for proper in-process prescription till dispensing and promotion of healthcare. We have seen minimum requirements to open retail and wholesale drug stores, what all the licenses, whether it may be the Schedule N categories or the minimum space required, we have seen and we have tried to understand in detail. We have seen various types of drug stores, whether it may be the traditional personal service, medication, prescription-oriented, pharmaceutical, super drug stores. Mainly it can be classified into 5 types. We have seen different types of drug stores. Then we have seen legal requirements for establishing retail drug stores, license, staff, various staff required, various records he has to maintain. We have seen all those things. And finally, we have seen the role and responsibilities of the community pharmacy in the society. Thank you.